Hey everybody, welcome to Dr. B Q&A. We're going to be talking about postpartum depression, so stay tuned. Okay, so I have my DSM with me, which is the diagnosing manual that all clinicians use in the US. And I was kind of going through it, just kind of brushing up a little bit on postpartum depression. And there's a new manual that was put out just recently, the DSM-5. And in that, it is now called Major Depressive Disorder with Peripartum Onset, which means that peripartum means that anytime between a few weeks before you have the baby to a few months after you've had the baby, after delivery. So this is something that I think sometimes gets missed because right after we've had a baby, we tend to be really exhausted. Our emotions are everywhere. We're hormonal. We're feeling overtouched, overstressed, overwhelmed with life. We have that mixed with euphoria after just having a baby and seeing this beautiful thing in front of us in most situations. And so there's a lot of mixed up emotions and feelings and chemicals happening in the body. So I think sometimes postpartum depression gets lost and people don't realize that is what they're feeling and that is what they're dealing with. They think it's just baby blues or afterbirth stuff that's going on when really they're dealing with depression. So in the DSM-5, it's called Major Depressive Disorder with the Peripartum Onset. Some of the symptoms, I want to go over those really quickly, are very similar to regular major depressive disorder or depression. And I'm just going to list a few of those. Symptoms tend to be depressed mood or isolation, if you feel yourself kind of pulling away from the people you love. Loss of interest in things that used to bring you pleasure, including sex. Sleep disturbances are huge, but like, how are you going to tell that when you just had a baby and your sleep is being disturbed constantly? And then there's loss of appetite or weight gain, irritability, feelings of worthlessness, and maybe guilt at times. Concentration problems, which is another thing that may get mixed up with just after having a baby and dealing with the stress of life after having a baby, but that can also be a symptom of depression. And thoughts of death or suicide, which I think are the huge red flag. Obviously, at that point, you know that there's something else going on. Hopefully, you know at that point that there's something else going on, something major that needs to be looked at. So now that we know some of the symptoms, and I think a lot of people do, I think that's kind of a common thing to be aware of with depression. The word's getting out a little more. People are aware of some of those feelings and some of those symptoms and what to look for with depression. But I want to clarify that a lot of these things are comorbid with the postpartum experience. After you've had a baby, these things happen anyway. So it's like, am I feeling depressed or did I just have a baby? And my take would be either way, you probably should stop for a second and really evaluate what's going on with you and decide if it's time to take action to help treat some of these symptoms or find tools that will help alleviate some of the stress, some of the depression, some of the mood swings, etc. So I'm going to talk a little bit about treatment options really quickly for MDD, major depressive disorder after birth. And the first and foremost that I would recommend is psychotherapy or talk therapy, seeing a therapist, combined with pharmacology. Usually, and studies have shown that you can take antidepressants and that will help for a while, and you can go to a therapist without antidepressants and that will help. But the best results come from a combined effort on both parts. So if you're taking antidepressants, please see a therapist as well. Go to talk therapy, do some cognitive behavioral therapy. There's lots of different kinds of therapy to choose from that will help depression. If you find somebody that you can trust, or if you need recommendations for a therapist, I'd be happy to talk to you. Or if you know of somebody or there's people on your insurance, whatever, find somewhere to do your talk therapy alongside the antidepressants. That's where statistics show the most improvement. Along with that, I'd say talk to your support network. Let your partner know how you're feeling. Be open, and your family members, friends, let people know what you're going through. I know sometimes in our society, depression is dealt with or come from a place of shame, and that's something that I really would like to change. It's not shameful. Your body is going through stuff. You don't know, everything that's happening in there. I think it takes a lot of strength to talk about those things. It hurts to discuss those things. It's uncomfortable, but in the end, we can come out of this, we can treat this, we can get rid of these feelings, we can move through these feelings, or at least gain tools to help us deal with these feelings, cope with these feelings, and move forward and find some happiness again, find some, level things out a little bit. So tell people, tell your support network, get some help that way so that they understand what's going on with you, what to look for, how to support you. I always say to use I need statements. I need XYZ from you at this time, because sometimes people know that you're going through something, but they don't know how to support you. So I statements are huge. I need it from you at this time, please. And I think that's really helpful. And then this one's kind of a catch-22, but getting enough rest is key. Your brain needs that to heal. So if you can get rest with a newborn baby, I know that's like so crazy to even say because I've been there, 3 children, I understand. But if you can, take naps. Don't feel guilty about naps. Sleep when the baby does. Sleep at night. Do the things that you need to so that your body can heal. As it goes through the healing process, if you're doing some of these other things to build coping skills, etc., then that will be really helpful. Anyway, there's my quick video, and hopefully this was helpful to you. If you have any questions, please let me know. I'd be happy to do a video on any questions, comments that you might have. Check out some of my other videos as well, and don't forget to subscribe and share, please. I'm trying to get the word out there. I appreciate the support. Talk to you later.